TNT Open Mind Insights brings you powerful, authentic conversations, illuminating the path to better mental health care for all.
Good morning, Justine. It's really exciting to be here with you today. I know you a little bit, but I'm hoping to get the audience to get to know you. Do you mind just kind of introducing yourself and where you are these days and what you're doing?
Yeah, so I'm Justine Welsh. I'm an associate professor in the Department of Psychiatry and Behavioral Sciences at Emory University. And in that role, I'm the vice chair of Child, Adolescent, and Young Adult Services, and I'm also the director of Addiction Services for Emory Healthcare.
You're kind of a big deal,
It
Justine.
was a mouthful.
That's a lot of things. I think I'm always curious whenever I meet, especially another physician, what got you interested in kind of medicine? And I'll jump a little bit like into psychiatry. Um, yeah, what drove you to that?
I think it started in my early childhood. My mom and her husband are both clinical psychologists, now retired, but they co ran a mental health center in Homer, Alaska when I was a kid. And I used to spend a lot of time in that waiting room, just kind of observing what was going on and hearing my parents' discussion. So I think I had an interest in people and in people's stories from very early on. And then when I went through school, that interest just grew. And by the time I hit medical school, I considered being a surgeon, but went back to psychiatry because I really enjoyed talking to people and helping them in that way. And then it just kind of unfolded from there.
Oh, that's so cool. What was it like growing up with psychology parents?
I've been asked that a lot. I would say that our dinner conversations are probably not the norm.
What'd you talk about?
Well, I think I probably zoned out for a lot of it,
Yeah.
because there was a lot of shop talk between the two of them.
Yeah.
But I believe that that experience really instilled just a empathy and a compassion for people, for humanity, for the struggles that even if someone's not aware, someone else is going through, it's occurring. And so yeah, I think it was informative.
Yes, I mean, so it sounds like from an early age, as much as, you may have lived hopefully, a good life your parents provided for you, you weren't necessarily sheltered from the fact that everyone doesn't have those same things, that, people have aspects of their lives, their stories, their personalities that can really influence them and kind of what they experience and how they view the world.
100%. You said it very well.
Um, and then, what led you to say you kind psychiatry, very broad, great field. What made you then want to concentrate specifically on, youth, children, adolescents, and then even into addiction?
Yeah, so I think it was just exposure through different rotations where I was really drawn to working with families. I come from a divorced family myself, and I could see the impact of distance on families and relationships and different forms of communication that naturally have to unfold because of that. And I really loved working with families, but something drew me to the addiction world because individuals with substance use disorder and in recovery, they just have a powerful sense of resiliency. And I really just had an appreciation of the biological underpinnings of addiction. And so I was able to go into both child adolescent psychiatry,
Mm.
but then also do additional training in addiction and really just marry my two interests and my passion and be able to kind of create my own path forward.
Okay, that's awesome. I'm very curious to hear your spiel to say a non-medical audience about, why are we why is addiction medicine so important, especially right now?
Oh my goodness. This might be longer than we have to
Let's go.
talk. But, well, we're seeing just a rise in rates of substance use disorder across the United States. So, right now, when you look at kind of the prevalence, so the percentage of individuals here in the United States that are ages, say, 12 to 17, about 8.7% meet criteria for a substance use disorder. And so that's not just using substances, that's having problems and issues with relationships, with functioning, with going to school. because of the substance use. Then when you look at young adults, that goes up to 27%. So that's over 1 in 4 of our young
Yeah.
adults meets criteria in the past year for substance use disorder. And then you look at some of the rates of older adulthood, and about 1 in 4 to 1 in 3 individuals here in the US will develop a substance use disorder at some point in their life. So if it's not impacting you personally, it's impacting a loved one, a family, a friend, a colleague at work. It's pervasive, it doesn't discriminate. And we're really seeing a dramatic increase in deaths because of opioid overdose. But then I also don't want to miss that we're still seeing high rates of mortality because of tobacco related causes. Nearly 480,000 Americans lose their lives every year because of a smoking related cause. And so there's just so much work to be done. And we really just, we don't have enough people doing it.
Yeah, no, thank you. And, I think hearing the statistics is always staggering. You don't necessarily think, almost 1 in 10, kids under 18, and then 1 in 4 young adults. Like, that's a lot. Um, I'm sure it's multifactorial, but like, what do you think are some of the reasons we're seeing this level, this prevalence, and this growing, concern of substance use disorders?
Yeah, again, I think there are multiple reasons. So you take opioids, for example, and you have an entire group over many years who were exposed to prescribed opioids, who then developed a physiologic dependence, meaning people would go into withdrawal, they developed tolerance when they didn't have opioids. And then that took off, created the opioid
Yeah.
epidemic, and transitioned to other products, heroin, fentanyl. So there's that pathway, but then there's also an increased accessibility of other
Mhm.
substances. So take a look at cannabis. Legalization of cannabis has reduced the perceived risks of cannabis exposure, particularly for young people. And you could
Yeah,
argue the pros and cons of legalization
sure.
all day.
We will
But
not
what
do that
we will
today.
not do that today. But what we really have seen is an increase in our young people in using cannabis
Yeah.
related products. And the earlier you get exposed to substances, the more likely you're going to develop a problem because of use later on in life. So again, it speaks to all sorts of things from exposure, access to genetics to, prescriptions, etc. So
Yeah. Um, and I think sometimes this can be hard for people to understand because they think maybe, oh well, I experimented in my childhood and it wasn't so bad. So why do you think that does not apply to the here and now? Like, how is it when people think about their past, almost kind of, with rose-colored tinted glasses?
yeah,
What's different about the situation now?
there are a lot of things that are different, and everybody's journey is individualized. So I caution people in saying, I didn't develop a problem because I, had my first drink of alcohol at
Yeah,
15, you know, and now my kid is doing the same thing. I'm sure they won't have a problem. Like, you can't make those assumptions because
sure.
everybody's life circumstances are different. We know that ADHD, anxiety, depression, all of these psychiatric disorders increases the risk
Hmm.
of developing problems with substances, and we have higher rates of depression, of anxiety in young people than we
Yeah,
have ever had before. And then, you take also what are the substances being used. So Woodstock cannabis was 3% THC,
hmm,
whereas we're now looking at THC products averaging between 15 to 20% THC.
oh wow,
So it's a completely different substance
yeah.
for how it interacts with the receptors in the brain and in the body. So it's not a one-to-one comparison across a lot of these substances these days.
Yeah, no, thank you. And again, I think that sometimes gets lost when people, like you said, are just thinking about themselves in the past
Mhm.
and forgetting how different things are now. And thank you for just talking about how just children's mental health is at kind of a crisis point, really, in the past couple of years. It's been named that. Could you expound a little bit more on how you say, kids with these, anxiety, depressive disorders, ADHD overlap with kids with substance use disorders?
Absolutely. So it's the chicken or the egg.
Mhm.
If you have a depressive disorder, you are more likely to use substances and to develop a problem from substance use. If you are using substances, you're more likely to develop depression. And the same relationship goes across multiple diagnoses, ADHD, to some degree, anxiety. And so there's a very close relationship. And then when you look at safety concerns like
Yeah.
suicidal thoughts, there's actually a dose dependent relationship. So when you look at the frequency that someone's using substances, that goes from monthly to weekly to daily or near daily, the percentage of individuals with suicidal thoughts just incrementally
Yeah.
increases. And so you see direct relationships between substance use, psychiatric symptoms, and suicide risk.
Yeah. And obviously, suicidality is a huge concern, really, in the pediatric young adult population. And so, thinking about it in the context of, the mental health concern and how you can't really separate out, say, addiction medicine from that, how it really is a part of a bigger picture. And kind of getting to your first point about how, people have their lives and what's going on in their lives, whether it's genetic risk factors or other things going on environmentally. I'm very curious. What is, if a patient were to come to see you for the first time in your clinic, what is that experience like?
Well, I would say it's different for everybody. Not everyone is, let's say, excited about coming to see a psychiatrist, a
Sure.
mental health provider, or for someone who specializes in addiction treatment. And so some of my patients are really presenting because they've asked for it.
Mm.
They've acknowledged that I need help, I need additional support because maybe they recognize their use has gotten out of hand and they're having trouble focusing at school. So we're talking about younger people here. But then I have others that have maybe had their first run in with law enforcement and now they have a felony
Mm.
because of substance use possession. And their families kind of rallying around them to say, no, we have to address this.
Yeah.
This has gotten this far and we maybe didn't see or the signs weren't visible before, but now they are. And so I think the experience is different for everybody.
Sure.
Um, but some of the common themes are really just trying to create a welcome and inclusive environment
Yeah.
and working with the family, maintaining confidentiality if it's a minor. So, in that regard, we want people to be able to talk to us, to
Yeah.
share their experience and what they're going through so that we can best help them. But you don't want to share everything that a young person says to you with the parent or the caregiver or the guardian. But there are some lines that you have to draw when it comes to safety. So a lot of that first session is navigating the disclosure, the
Yeah.
confidentiality, creating that safe space for
Yeah.
care, and then really identifying what are the needs of the individual and what are the needs of the entire family system.
Yeah. I love the way you say that. Do you have any tips as you kind of teach others to do this kind of work? How you kind of build that empathy, that rapport, say with your direct patient, also acknowledging that they exist in, a family, a community that is also seeking help.
Yeah, so for the clinicians, I would say give yourself some grace. It can be challenging, but also incredibly rewarding, and sometimes just takes time. So, like I said, a lot of the patients that come to see me, they're not excited about seeing me because they've been confronted with something that
Sure.
has very recently
Yeah.
happened, and now they're recognizing that that they need help, and that might
Yeah.
be the first time that they've ever said that.
Sure.
So for clinicians, I'd say give yourself grace, but also be informed of evidence-based treatment
Mhm.
practices. What data do we have on medications for young people? What data don't we have, more specifically, on medications for young people?
Yes.
Because there has been a lot more focus on at least addiction treatment for older adults
Definitely. Yeah.
than there has been for young adults
Hmm.
and for adolescents. And then how do you really work with families? How do you navigate what could be sometimes very challenging family dynamics while also recognizing the strengths of the family system and utilizing that to support the young person in care?
Yeah, no, thank you. That's great. You're clearly so passionate about this. What do you find most rewarding about this work that you do?
Oh my goodness. There are a lot of things. The reward, I think it comes from seeing just a shift in the family
Mhm.
dynamics where they might have been ones of a very negative
Mhm.
communication of just consequence
Yeah,
oriented to healthy positive communication and support of one another. I love it when I get to see some of my patients get a GED or graduate high school because that wasn't even on the table.
yeah,
I also, am just so incredibly grateful when my families are educated on how to use naloxone. I've had plenty of young people overdose and family members administer the naloxone and oversee the reversal and essentially save their child's life.
yeah,
And that's priceless.
yeah. I mean, from the literally saving kids' lives to helping them achieve, small to big goals that wouldn't have been possible without getting appropriate treatment. And again, someone who cares about them and their families and their communities to kind of move them forward. I think that's awesome. Thank you for the work that you do.
Oh, well, thank you for letting me share it.
You do a lot of, you're the vice chair of education. You work for the TNT program. As you educate others, what is the most important thing for them to understand about addiction medicine or about how to treat youth and families and communities that really are suffering?
I think being humble and understanding that it is a lifelong learning process. I am continuing to learn. And I learn from the families I work with who educate me every day. I learn from my colleagues. I learn from the literature. And it's an evolving field,
Yeah.
especially when you look at drug use trends. They are constantly changing. And sometimes I'll be with a patient and they'll describe what they've been using recently, and I don't even know what it is
Yeah. How do
because
you how do you keep up with?
well, I turn around and I Google it and I say, well, tell me more about that. And I have to figure out what is it that they are
Yeah.
likely using, what safety risks does it have, could there be any interactions with the medications that I'm prescribing. So I have to be open to learning new things and to investigating and asking questions.
Okay, that's awesome. I was gonna say because yeah, I always find that sometimes kids are telling me something. I'm like, I have no idea what you're talking about.
And it's okay to say that.
And sometimes I ask them, and they actually love telling me about what it is that they're doing, where they're getting it. I'm like, this is very educational for me, and it also just somehow ends up like building a rapport with
Yeah.
them.
Well, what's even scarier, sometimes they don't know and that they can't tell you because they're not aware of what they've been using.
Yeah,
And
and
that's an opportunity for psychoeducation and for really talking about the risks of not knowing what you're putting into your body and what effects it could have.
yeah, and depending on the context you're seeing them. So I often see kids either in the emergency room or who've been admitted to the medical hospital due to, some medical sequela of what's gone on, right? They could have some of those very serious consequences. So I've certainly seen kids who are, have an acute change in mental status. They appear at least briefly psychotic,
Hmm.
or people who just kind of are, really knocked out and sometimes even in the ICU for support after, significant overdoses. And, that's a scary thing for them. That's a scary thing for their families.
Absolutely. And it's a very vulnerable time for everybody involved, which is why we need to be educating the healthcare system on how to respond appropriately and to make sure that we don't alienate people from treatment
Yes.
and that they're wanting to come back to see us again.
No, that's awesome. So we have a healthcare system that exists in its current state. If you had a magic wand,
Oh gosh,
how
the
would you
magic
like
wand
the magic wand
question.
question? How would you like to see things change and kind of how the healthcare system approaches patients with addiction?
I would like to see addiction really being recognized on par, on level with all other medical conditions. So being able to talk to someone without the stigma and that, oh, you have a substance use disorder, you have an alcohol use disorder, an
Mhm.
opioid use disorder, and there's not a level of stigma behind it, and that it's raised to the point of, oh, you have diabetes or hypertension, and we just simply need to treat it for the medical disease that it is.
Yeah.
And unfortunately, I think there are a number of artificial barriers that exist for our patients and for our providers in our healthcare system because there is that pervasive stigma that still persists and
Mhm.
undermines that equality of care and the services that were provided. A lot of addiction services are delivered in silos
Mhm.
versus being integrated within
Yeah.
the rest of the healthcare system. And when we're thinking about educating our next generation of healthcare providers, really setting the expectation that they need to know how to treat substance use disorder just as well as they need to know how to treat diabetes, hypertension, asthma.
Yeah.
There's
And
my wand.
I love your wand. And even when you think about how, how these are depicted, say in, media or social media, right? There's usually like a negative, oh, this person, again, that stigma appears in kind of how they're depicted and what's going on, whereas you don't see those necessarily with the medical diagnoses. I think the other psychiatric diagnoses fall somewhere in the middle. Like you're just not doing enough, or oh, just don't be anxious. Oh, just don't drink alcohol.
Yeah.
Just don't smoke. It's that easy. And people don't necessarily understand the illness behind that, or kind of the drivers behind some of those symptoms.
Absolutely. The belief that it's a moral failing or
Hmm.
that it's a choice or that someone has control over a substance use disorder once it's progressed to that point is a misbelief. And it really is what's driving continued stigma.
Yeah. You mentioned some artificial barriers, and we started talking about some of them that you treat them separately in a silo, and then people don't get any of those, don't necessarily get the same training. What are some of the other artificial barriers that you think like the healthcare system really needs to work on tackling over the next 5, 10, 20 years?
Well, I would say reimbursement around substance use disorder, and again, recognizing the need for services and for treatment to the same degree as other medical conditions.
Yeah.
There's still a lot of hoops that we have to jump through as far as payer contracts to provide adequate reimbursement for healthcare systems to even break even when it comes to providing
Mm.
addiction oriented care. And then also thinking about how do you really integrate screening for substance use into a healthcare system. If you're going to do that, you have to have resources on the back end or education for the existing providers to be able to address the substance use. So, why would you ask about it if you're not going to do anything about it? And
Yeah.
how can you do anything about it if you're not educated on what to do and you don't have the resources to step in when you need support and help to provide that care?
Or the confidence to then have the conversation
Yes.
once that screen
Yes.
is positive. And I'm going to have you focus on that question again and really focus on kind of pediatric training. So in my pediatric residency, I'm like trying to think back. I don't think I got any information about addiction services. Mind you, I also had a adult and child psychiatry training in which I did. Um, and again, what do you hope that future either pediatric providers or other providers who treat children, what do you hope that they are being taught or learn going forward?
I think it goes back to everything that we do in treatment. I mean, I hope that they're being taught to ask about substances, to do it in a sensitive way, and then to be able to really address the substance use, especially when it's gotten to the point where it's problematic.
Hmm.
And then how do you navigate the family involvement and knowing what community resources exist if you're unable to provide those services in your own pediatric setting?
Sure.
So I would love to see, the entire continuum of care from uh, early intervention to actual treatment delivery
Yeah.
taught to pediatricians because like we talked about, nearly 1 in 10 adolescents already has a substance use disorder.
Yeah. I'm
That's
gonna
not just
highlight that again. It's
using.
it's not just like, oh, I smoke on the weekends, I go to a party and I do X, Y, or Z. A substance use disorder. What does it entail to have a substance use disorder as an adolescent?
Well, you have to have a level of impairment of functioning, and so we're looking at marking off different criteria, and so it exists on a continuum of mild, moderate to severe
Yeah.
based on the number of criteria met. But you can see tolerance to substances, withdrawal when you stop using, impairment in school or work functioning or relationships. So these are the kids that are coming in and they are at risk of failing the grade. They've stopped turning in assignments. They might have dropped off the sports team.
Yeah.
They're in conflict with their parents. They might have had a citation at school for substance use or possession. And maybe they're now also in trouble with the law. And you just see this kind of cascade that has a snowball effect.
Yeah.
But again, it's on a continuum. So you can also see the kid who's really gone under the radar,
Hmm.
but maybe is experiencing symptoms of depression and possibly thoughts of self harm or suicide, who might be using cannabis daily, but has not flagged to anyone that they're really suffering inside. So you can see the external, but you can also identify the
And
internal.
some of those really high achieving kids, are really tough because nobody knows something is going on with them,
Yeah,
either from the depression or anxiety side or the substance use side. And
absolutely.
again, you meet them and they say, "Well, doc, the marijuana is the only thing that helps with my anxiety."
Mhm.
How do you talk to that kid?
That's a tough one. But what I found is that adolescents, they want to know the facts. They don't want to know the you should, you shouldn't. They want to know the why.
Their
Like
parents tell
tell
them you should, you
yeah,
shouldn't. You're
yeah.
not there to be their
No,
parent.
they want to know the why.
Mhm.
So I will actually talk about the neurobiology. I'll talk about the receptors in the brain, how the cannabis that they're using is actually depleting their reserve stores of dopamine in the frontal lobes. And while they may feel better while they're actively using, every time that they have the substance out of their body, they have lower reserves of those neurotransmitters from which to work. We also talk about the long term side effects of cannabis. And so, especially for these higher achieving students, saying, by the time you're 35, you could see up to an 8-point decline in overall IQ
Mhm.
is a little scary. It
Yeah.
has a number to it. It's not saying, hey, you smoke cannabis, this is going to happen to you. It's no, we've actually done studies. Would you like to go through some of them with me? We can talk through what we know,
Yeah.
what we don't know. So, a lot of it's individualized. It's getting a sense for what are they interested in knowing and understanding? What do they already know?
Mhm.
Correcting some of those misperceptions, and then also understanding and validating what are their reasons for use,
Yeah.
because without
Mhm.
knowing that, it's very hard to say, well, I'm going to take this thing away from you, which you find really helpful. Maybe you don't understand everything else that it's doing to you. I'm going to take it away from you, and I'm going to just leave that. And they're like, well, how is that helping me?
Yeah.
So you have to identify the carrot, the reasons for
Mhm.
use, and work with them. So maybe it's someone who has a lot of social anxiety,
Mhm.
who is going to a party but finds it absolutely overwhelming
Yeah.
not to have used something before they go to that
Yeah.
party. Well, I can work with that.
Mhm.
How about we try to take away that social
It
anxiety
gives you a
across
target for
all
treatment and
contexts?
an
Yes.
alternative to say the substance for the treatment of whatever it is that really is their pain point.
Yep. Yep. And so then we can work on that. Well, what if I could help you feel better in those situations all the time? Would you be willing to work with me on that? And so I work from a harm reduction
Mhm.
perspective. You don't have to agree to absolutely quit using substances to see me. I'll meet you where you're at.
Yeah.
There are a lot of times some confines that we have to work with around parental
Mhm.
expectations, the
Sure.
justice system, all of those things, and then also safety. But let's see if we can get some movement with that anxiety as we're taking a closer look at how the cannabis use is influencing that. And that applies to various substances.
That's awesome. Thank you. I might use your video spiel and use it myself when I talk to kids about marijuana. But yeah, I always say, what does it do for you? Because I think everyone else is just telling them don't smoke, and
Yeah.
they roll their eyes because they're like, you don't understand me. And like, obviously, everyone is telling them that. But if you go that extra step to kind of understand, I'm like, I assume they're smart. You're smart. You know there's negative effects. It's easy enough to know that and Google it. What makes it still worthwhile to you?
Yeah.
Um, Again, you do a ton of education for, pediatricians, family med docs, primary care providers. For someone who's out there who kind of is recognizing how much addiction and substance use is really affecting the communities they work in, and they want to be better at doing this kind of work. What suggestions do you have for them?
I would say become educated. There are a lot of fantastic resources online that will talk you through what medications are available, how you might be thinking about using them, harm reduction practices. So, if you're working in a community where there's a lot of substance exposure, particularly to high potency opioids like fentanyl, making sure that you are either providing naloxone to your patients, which is the opioid overdose
Sure.
reversal agent,
Yeah.
or you know where people can obtain free naloxone. In states where it's legal, also thinking about fentanyl testing strips so that people are informed of the substances that they're using, and counseling on safe use practices. So, I mean, those are just very early, but anyone in primary care can really start to address substance use. It just takes asking about it and then having a level of comfort of how do I hold the information that I've received and what can I do with it? But there's a lot of education out there. Train New Trainers is a prime example of that.
Thank you so much for your time.
Well, thank you. I
You're welcome.
appreciate it.